Fear coverage of COVID-19. Ohio's case numbers for COVID and hospitalizations are seeing a significant increase. Take a look here. Today, the Department of Health reported nearly 6,900 new cases over the past week. That increase is 2,000 more than last week's increase. New hospitalizations are up 428. That's 100 more than last week.
And the increase comes as the debate over federal travel mask mandates continues. The Justice Department says it's appealing a federal judge's ruling that struck down the measure Monday. The CDC has wanted the mandate in place until at least May 3rd, while it determined if it was still needed. And now that back and forth has caused a lot of confusion for people, and that's why we have one of our experts joining us tonight. Dr. Ian Gonsenhauser from OSU Wexner Medical Center is here to answer our questions. Ian, Dr. Gonsenhauser, thanks for being here. We'll start off with this. When it comes to the mandate debate, information on what to do, what info can people look at when they're weighing whether or not to mask up if they're getting on an airplane or getting on a charter bus? What should they be looking at?
Yeah, in many ways, this is getting simpler and simpler for people because at this point, it's more about your personal individual risk than anything else. We're going to see the numbers continue to vary, ups and downs with variants and subvariants. As we see right now, the number is increasing. But at the end of the day, the most important thing is to know your personal risk and make sure you're making the decisions that put you in the best position. That means if you have a high risk symptom, a high risk comorbidity, you're putting that mask on or you're being extra cautious when you're traveling.
Well, let's talk about that subvariant. Officials say that new subvariant of BA2 spreads about 25% faster than the original subvariant. What else do we know about this subvariant?
Yeah, at this point, we know that it spreads and is even more transmissible than the previous Omicron variant. What we're seeing is really a similar symptom load, symptomology. The symptoms are fairly similar and the outcomes are fairly similar. What we're not seeing yet is that big spike in hospitalizations and deaths like we saw with the Delta and prior variants. But, there's still cause to be concerned just seeing those numbers shooting up.
And speaking of those numbers shooting up, we're seeing those weekly increases doubling. Are we heading towards a surge, you think?
Very hard to say. Over the past 2 weeks across the nation, we've seen a 50% increase in the total number of new cases. Again, hospitalizations, ICU hospitalizations, and deaths are still stable, even declining nationally. But that trend follows, we know, a few weeks later. We're seeing in the east and the eastern seaboard very, very significant increases. And so what we don't know right now is where that will level off, where that plateau will be. Will this be a spike or will this sort of be just a new baseline? And that's what it's going to take us a bit of time to understand.
Yeah, since we don't know, Doc, is this a reason for concern at this point?
I think any uptick in the numbers is a reason to be aware, to pay attention, and to potentially raise our alert levels. At this point, we don't know what this will mean for us as a community, as a region, but it's certainly something to keep a close eye on. And again, if you're in that high risk category, keeping very close eye on where you're going and what you're exposing yourself to, because this simply means that there's a lot more in the community once again.
And what's your message for folks who maybe haven't been vaccinated yet, or maybe they haven't gone for a booster shot, or maybe they're eligible for those additional booster shots? What's your message there?
Yeah, if you're eligible for a booster, you haven't been boosted or you haven't been vaccinated, now is a very good time, as good a time as any. And I think it's going to be hard to convince folks who have decided at this point to never become vaccinated. But, those are really the groups, those are the small communities that are at greatest risk. And hospitals in communities that have significant burden of unvaccinated individuals, they're going to continue to struggle under the weight of COVID.
All right. And Dr. Gonsenhauser, is there anything else you'd like to add tonight?
I think just be cautious. We're headed into the summer months. We all tend to relax. There's nothing that we all need to be, overly anxious about in this moment, but it is something that we just need to have, on the side burner, that we have to have eyes on. We have to be watching because we don't know what's down the road.
Something to keep in mind. We're not done with this just yet. Dr. Ian Gonsenhauser, OSU Wexner Medical Center. We always appreciate your time.